Wait, is this recording? It's recording.
It thinks it's sideways though.
I mean, it is sideways.
Yeah, but like it's acting like it's portrait.
So what do? Do I have Grace come sit over here?
Or you can just go grab your laptop. What?
He said, what is Crohn's disease?
Presentations of the year. You guys all get a little taste of what y'all are going to be in for in the spring. So we've got two presenters today. And so Caitlin is going to present to you first, talking about Crohn's disease, some of the problems behind that, and some of the possible or alternative treatments for it.
Good afternoon, everyone. My name is Caitlin Trevathan, and today I'm going to talk about the treatment options of Crohn's disease, and more specifically, I'm going to discuss Western medicinal, holistic, and alternative practices. So the first thing I want to address is what is Crohn's disease. It is one of two branches of inflammatory bowel disease, which is also abbreviated as IBD, which affects the digestive tract anywhere from the mouth to the anus. And most people are not diagnosed until the age of 30 because their symptoms don't flare until later into adulthood. So like high school and college age kids are when your symptoms normally flare. Crohn's disease is considered active when a patient has symptoms or inflammation. And then when these are resolved, they're considered to be in remission. However, they can relapse at any time. And because of the different levels of Crohn's, there's different types of remission based on your symptoms or inflammation and then what's going on in your digestive tract. So here I've put a picture of a healthy colon, which is on your left, and my colon with Crohn's disease on your right. As you can see on the non-diseased colon, it's really smooth, open, and then here where you see, like right here on the white, that's an ulcer, and that's often one of the complications with Crohn's, as well as the swelling that's making it compact and closing it off. So another thing I want to address is the difference between IBD and IBS. These are often grouped together from the general public, however they're very different. IBD stands for inflammatory bowel disease, while IBS is irritable bowel syndrome. So IBS is seen more as a functional issue rather than a genetic and like a gene mutation, and it doesn't cause the destruction, inflammation, or abnormalities to the digestive tract that IBD does. Another difference that I'd like to point out is the other branch of IBD that I mentioned earlier is ulcerative colitis, and these are very different. They appear differently when a patient presents to a doctor. So in Crohn's disease, you normally present with right lower quadrant pain, while ulcerative colitis presents with left lower quadrant pain. Another difference is where they're located. Crohn's affects the entire digestive tract, while ulcerative colitis is only found within the colon, and people with Crohn's disease often have more problems with malnutrition. So here I've used, again, the picture of Crohn's disease, and here is one with ulcerative colitis. You can see the difference in how obstructive the Crohn's disease one is, where ulcerative colitis isn't as closed off, and it's more ulcerations than like the inflammation and polyps that you get with Crohn's. So some of the symptoms of Crohn's disease are hematochezia, which is blood in your stool, diarrhea, abdominal pain, cramping, fatigue, nausea, vomiting, and reduced appetite, along with weight loss, malnutrition, and mouth sores. Another thing to point out here is that everybody with Crohn's disease presents differently, so they can have any of these, any combination of these, and there's also more that they can have. It just varies depending on your body. Some risk factors of Crohn's disease is family history. So if, again, like if you have like any disease, if a family member has it, you're more likely to develop Crohn's throughout your life. If you smoke, it increases inflammation in the body, and it can increase your risk of developing Crohn's. Non-steroidal anti-inflammatory drugs, or your NSAIDs, if you take them a lot, there's been correlation with people that develop Crohn's disease. However, it's unclear why you get Crohn's if you take a lot of these. And then also people with high amounts of stress, because stress increases the inflammation in your body, so those people are also more prone to get Crohn's. So to diagnose Crohn's disease, they do a bunch of blood work, stool samples, CT scans, and endoscopies. The blood test that they usually do is a CBC, which is a complete blood count to look for infections and anemia. And then they do a CRP and ESR to look for inflammation. The ESR is really cool because they draw blood and put it in these tubes. And it's, I think, 10 minutes, and you put it at the top of the tube and fill it up. If it drops, then that means you have high inflammation in your body. And if it stays at the line that you filled it up to, it means that you don't have a lot of inflammation. They also use blood tests to check your electrolyte panels and your B12 to check for malnutrition. The stool samples they use to check for bacteria and infections like C. diff, because sometimes if you get things like that, it can present as Crohn's disease and not actually be Crohn's. And then if all of these have the markers for Crohn's disease, you move on to CT scans to check for blockages and rule out appendicitis. And the reason you have to rule out appendicitis is because appendicitis also has that right-sided abdominal pain that Crohn's presents as. And then after that, you do an endoscopy, which is a thin scope that can be used to explore any type of the digestive tract. And then these are all different forms of endoscopies, and each one just explores different parts of your digestive system. So some complications of Crohn's disease can be anemia due to the high blood loss in your stool and just the inflammation in general, which leads to a whole other part of medical problems. Also, the chronic inflammation that Crohn's can cause causes scarring and narrowing of the intestines, which can cause bowel blockages and obstructions, which may need surgery. And I'm going to touch on the surgeries in a second. The most common complication of Crohn's is ulcers, which, as y'all saw in the pictures, there's often a lot of them. And they can also cause open sores like in your mouth and anywhere in your digestive tract. And when these burst, they can be really painful and also bleed. Finally, another diagnosis you can get is esophagitis, which is inflammation of the esophagus due to the inflammation of your digestive tract and prolonged episodes of vomiting and acid reflux. Other complications can include, but are not limited to, which is gastroesophageal reflux disease, colon cancer, malnutrition, and a diagnosis of any other autoimmune disorder. So these are the Western medicinal treatments, which are common when you see a gastroenterologist. These are the treatments they're going to give you. First is the surgeries that I mentioned earlier to treat like bowel blockages and things. So an ileectomy is where they take part of the ileum, which is your small intestine, and remove it due to the damage the disease has caused and it's no longer functioning properly. When they do this, they create a opening in the abdominal wall during surgery and put a stoma by taking the end or a loop of the small intestine and putting it on the outside of your body, and then they attach a bag that's called an ileostomy to it for all your intestinal waste to go to. They can also do this with a colostomy and colectomy, which is when they remove the large intestine or the total intestine due to disease. The first classification of medications that they might give you is corticosteroids. The most common one is prednisone in hopes to reduce the inflammation in the body. And these are usually short-term and used in combination with other medications. The next type is your immune system suppressors. These target the immune system, which is attacking itself and causing the inflammation in the body. And the most common ones are azathioprine, imurid, and pyranethol. And then when people are placed on these, they can cause a bunch of complications like decreased potassium, and again, the hemoglobin and blood levels can fluctuate, and so these patients have to be closely monitored by a doctor. And then if these don't work, they might be put on methotrexate, which is an immune suppressor that's also a small dose of chemotherapy. And then finally, the final medication that you might get is Biologics. These are the ones you normally see on TV. These are done through IV or injections, and they target proteins in the immune system in hopes to reduce inflammation and treat the inflammation or damage made to the body. These are Intibia, which is an infusion, and that one stops certain immune cell molecules from binding to the intestinal lining. Remicade, Humira, and Cimzia, which are either injection or infusion. And these ones attack BTNF inhibitors that work to neutralize the immune system proteins and cause necrosis. And then the final one is Celera, which is relatively new. It's right now through injections and infusion. It's not super popular yet, but it interferes with the action of interleukin, which is a protein in the body that's involved in creating inflammation. So I'm going to talk about holistic medicine practices and alternative medicine practices in treating Crohn's, but I wanted to take a minute to address what each means. So holistic medicine focuses on the body as a whole rather than individual symptoms. This is super important for patients with IBD because while it's in your digestive tract and you see a gastroenterologist, which is a specialist for the digestive system, it can attack other things like your liver, your eyes, and your skin, but they don't necessarily always correlate that if you're just seeing one specialist. Alternative medicine is any range of medical therapies that are not regarded to as orthodox, and these things are like herbalism, homeopathy, and acupuncture. And then complementary medicine is when you use any of these practices with normal medicine that I just talked about. So some of the things I'm going to discuss is diet, and more specifically the Aip Diet, gluten and dairy-free diets, specific carbohydrate diets, and autoimmune protocol, breathing exercises, yoga, and bee therapy. I don't have a slide on bee therapy. It's only been used in the past year, and they're taking bee propolis, which helps to hold a beehive together, and they're extracting it and injecting it into patients. Again, it's only been done over the last year. They're saying it decreases inflammation, and they are going to do more studies on it, but right now it's so new, and yeah. So the first thing I want to dive a little deeper into is this Ibda diet that I found. It was a 4-week study where they drew labs and did scopes at the beginning of each study, and then put the patients on a diet for 4 weeks and see where they are at the end. So this diet modifies the use of certain carbohydrates by trying to eliminate them for a certain amount of time in order to decrease inflammation. These carbohydrates include things like lactose, wheat, corn, and refined sugars. When these are cut out, you can put an emphasis on the pre and probiotics in your life and create healthy eating habits. And patients can also learn what kind of foods they can digest when they're in a flare. So the diet is completed in 4 stages. The first stage is soft, well-cooked, pureed foods with no seeds. The second stage is the same as stage 1, however you can add in certain floppy foods and tender foods. The third stage allows patients to add in vegetables depending on their tolerance. And then the fourth stage is if you reach remission, you can eat whatever you want. However, if you've learned the food brings on your symptoms, you're not supposed to continue eating that food. So here I have a picture of each stage. So you can see, like, in stage 1, you can eat butternut squash and pureed vegetables like mushrooms, bananas, fish, chicken, because they're easy for the gut to digest. And then if you look at phase 2, you add in things like carrot and eggplants, watermelon, scallops. Phase 3 is everything from phase 1 and 2, plus like strawberries, pureed vegetables, dill, and kimchi. And you can add in beef, lamb, duck, and goose. And then phase 4 is no restrictions. And this is just that chart continued. So in this 4-week study of patients with IBD diet plus their medications, 100% of patients saw a decrease in their medication regimen prescribed from a gastroenterologist. And then when they redrew the labs and redid all of their scopes, they also saw improvements regarding physical symptoms and their scope and blood work. The next thing is the Aip diet, or the autoimmune protocol diet. This one's more generalized since it wasn't created specifically for patients with Crohn's and ulcerative colitis. It's a total elimination and reintroduction diet. It eliminates things through phases as well in order to find out what your trigger foods are. And trigger foods are just what brings on your symptoms. It goes through stages of eliminating grains, legumes, nightshades, dairy, eggs, coffee, alcohol, nuts, seeds, refined and processed sugar, oils, and the incense I mentioned earlier, and any food additives. And then after these are eliminated, patients go through a time period of reintroducing foods, and if any of their symptoms react when they reintroduce the food, they take it out. And then in this 6-week study, 73 patients achieved clinical remission with endoscopic improvements at the baseline. The next thing is yoga, and there's a lot of studies that physiological factors have been found to trigger IBD symptoms and worsen inflammation. So things like yoga can help reduce stress levels and thus reducing the inflammation in the body. There was a 12-week study where patients were taught all of these positions. Apparently these are good for specifically your gut and reducing inflammation in your gut. And so all of them tried this, and they did it for 20 minutes a day, and after 12 weeks, 80% saw improvements in their IBD symptoms, and they showed lower stress. The next thing is breathwork study. It was a 26-week study. 21 of the patients were on routine medications, and then 12 had a history of surgeries on top of the medications. This chart just shows all of the patients, their gender, their age, what their current medication regimen was, what GI surgeries they had ever had, and then which type of IBD they had, whether it was Crohn's or ulcerative colitis. So they were taught 3 different kinds of breaths throughout the study. Resonance breaths are done at 4.5 to 6 breaths per minute, and it creates a resistance to airflow through the small contraction of the laryngeal muscles, which expands and creates a calming effect while breathing. Hall breaths was a practice by the monks where you inhale a lot, and then on the exhale, you exhale very aggressively and yell ha and apply arm movements. And the monks believed that breathing was a whole body movement, and so by adding in the arm movements, it's helping to release the stress. When you're doing these, it's 15 breaths per minute compared to the 4.5 to 6. And then finally, the chime breaths are done at 5 breaths per minute, and it's basically when they chime the bell, you either inhale or exhale depending on which breath you were on. The patients were doing this for 26 weeks. There was a control group made at the beginning where they weren't taught any breathwork practices. They went to classes on how to maintain your health and make sure they were taking their maintenance medications. And at the end of the 26 weeks, when these patients that did the breath work were compared back to the control group, the patients that did the breath work had better physical symptoms, social function, quality of life, and their baseline results of inflammation and their scopes had improved, versus the control group has said that they actually felt worse or like maintained the same throughout the study. So why should we use both? With improvements in inflammation, it can lower the decrease of stress in the body and thus helping control the symptoms of IBD. Medications can do all they can to attack the proteins and stuff that's attacking your body by itself. However, they're not shown to be able to do that only on their own, so sometimes we do need the supplemental treatment on top of medications. And then when used together, patients have been seen to achieve and stay in remission longer, and then high stress levels increase inflammation in the body. And in conclusion, my research has led me to believe that when treating Crohn's disease, you should use alternative and holistic practices complementary to each other to decrease inflammation and better your symptoms.
Anybody have any questions?
Is it, or were you diagnosed like at a young age?
Me personally, I started having symptoms freshman year of college and didn't get a diagnosis officially until late sophomore year, I think. Like really late sophomore year. Yeah.
So, in your reading, your investigation of these alternative treatments, which one do you think has the best evidence for being helpful?
I personally, after reading and honestly doing some of them myself, I think the diets play a big factor, knowing what you can and can't eat. So like I had to cut out gluten completely, and if I eat any of it, I'm sick almost instantly. And I didn't realize that was even a trigger until trying one of these diets. And so I think they're super helpful in realizing and how to maintain yourself on top of medications.
All right. We're letting you off easy.
Brandon is our next speaker, but I'll help get the projector set up.